Hi, good evening. I hope you're all doing well and you can hear me quite clear. I have two guests today. That is Shazmin Kassam and Mary. Please switch on your cameras.
Good evening. Thank you for this opportunity. I'm sorry I can't switch on my camera. I'm in a situation. I just lost a friend right now, so I'm not in a perfect mode for a video, but I'm in. We are together.
We're so sorry to hear about that. Thank you very much for creating time. We hope you can be able to continue with the discussion.
Yes, we shall go on.
Thank you very much. Is Shazmin there?
Yes, I am.
So thank you very much. This is a live discussion, and the topic is debunking myths around breast cancer. It's Breast Cancer Awareness Month, and we want to learn more about breast cancer. So we'll start off with the introductions. Please, my panel, please introduce yourself, what you do, so that people know who we are today in this particular discussion. Start off with you, Mary.
Thank you. My name is Mary Nafula. I'm a breast cancer survivor and champion. I lost my right breast to cancer. This is my third year. And I'm also the founder and CEO of Warriors of Hope Foundation in Mombasa and other parts of the country. I'm a human rights defender, a counselor, and a global breast health educator. Thank you.
All right. Thank you very much for the introduction. Shazmin?
I'm Shazmin Kassam from Warriors of Hope Foundation. I'm a global breast health and cancer educator, a caregiver, and a counselor.
All right. Thank you very much. So let's start off from how do you identify, what are the early symptoms of breast cancer? Mary, this question will be for you. You're a breast cancer survivor. So
Yes.
what are some of the early symptoms?
Well, maybe I should start with defining what cancer is
Okay.
and
Please
allow
go
me
ahead.
to use both languages, English and Kiswahili. I hope it's comfortable for everyone.
That's okay.
Yeah. Cancer is like our bodies are made of cells, and some of the cells are supposed to, whenever the in our bodies, the cells are supposed to die in order for the new cells to be born. So like some of the cells decide to behave abnormally and form a tumor. So that is the situation where when the cells have decided to behave abnormally or be corrupt in a way, so that is when they form a tumor in an area, and then it's what we call cancer. But not all cancers form a tumor. We have so many symptoms, but mainly they come in a form of a tumor. So we have 12 signs of breast cancer. The first sign is a hard immovable lump, which is normally painless. So whenever you notice that you have a lump which is painless and it is immovable and it keeps growing, that is a symptom of breast cancer. The second sign is a sunken nipple. When the nipple keeps on sinking inside or retracting inside, it's a symptom of breast cancer. The other sign is skin sores. Whenever one has sores on the skin of the breast, which keeps coming you treat them and they keep coming back, that is a sign of breast cancer. Another one is a dimple, because normally when the breast look like a titi hukaa sawia, ama ile lile ziwa hukaa sawia, but when you see it, you notice that it has a dimple, that is a symptom of breast cancer. Another sign is orange peel skin. The skin of the breast changes to look like an orange peel. Another sign is growing vein. We all know that when a woman is pregnant or nursing, breastfeeding, the breast can have veins due to the milk ducts. But when you see that, when somebody doesn't breastfeed or is not pregnant and you see visible growing veins, that is a symptom of breast cancer. Another symptom is a red hot area. When you see one part of the breast is red and it is hot, and sometimes it becomes painful, that is a symptom of breast cancer. Another symptom is hard area, like you see one of the areas becomes very hard, and when you touch it, it's like inakukwaruza kwa lugha ya Kiswahili. That is a symptom of breast cancer. And then the last one is a nipple crust. Nipple crust ni ile hali ambayo ile chuchu inafanya magamba magamba, the nipple becomes like grayish with I don't know how I can explain it, but kwa lugha ya Kiswahili inafanya magamba. uh, let's differentiate. There are two situations. There's a situation called a condition called mastitis. This happens with women when they are breastfeeding, kwamba lile titi linakuwa na kama jivu jivu, linakuwa kama na kidonda. That's different, that is not a breast cancer. But unapoona kwamba lile titi haunyonyeshi na linakuwa na ile magamba magamba, it's a symptom of breast cancer. The last symptom is um, skis, sores on the skin of the breast. That is also a symptom of breast cancer. Yeah, thank you.
Right. Thank you very much. That is very insightful. And I've learned a lot. Maybe to you, Shazmin. I think Mary has given us around 12 signs. Is breast cancer only for women?
No, that is something that we are trying to debunk. That is one of the myths we are trying to debunk in the society. Breast cancer affects both men and women, although the percentage differs in men, but over the last few years, the percentage in men has increased due to several factors. Thank you.
Okay, thank you very much. So it affects both uh, female and male. What are the signs for male? Would they be some of what Mary has already mentioned?
Yes. Apparently, the inversion of the nipple, the orange peel skin, the bump, the lump. So apparently, most of the signs are just like the signs in female. But we also have to understand that the lump can also occur in the area of the armpit and the collarbone. Yes, most of the signs are just like Mary has discussed before.
Hmm. Okay, thank you very much. Uh, Mary, back to you.
Yes.
You mind sharing with us your journey when you identified that you had breast cancer and the treatment, and yeah, just share the journey so that somebody can learn on also how to prevent.
Yes. I was diagnosed in 2021. I had the lump, which was painless, and I ignored. Initially, I ignored the lump, so it kept growing, and gradually my nipple started retracting, it sank, and then the skin also changed to be like an orange peel. That is when it hit me that this might be over concern. So, together with my family, my husband, we went to hospital, and I was subjected to several tests. First, the doctor did to me the clinical examination, which is the physical, by pressing the hands on the breast to locate if there is a lump. And then I was subjected to a further test of breast ultrasound, which reveals the location of the lump and the size. After that, I was referred to another test, which is known as mammogram for both the breasts. Mammogram is a more intense radiography that can locate even the tiniest tumor on both the breasts. So I did mammogram. After mammogram, I went for FNA. FNA is fine needle aspiration, where a needle is used to extract some fluids from the lump. The results were not conclusive, so I was further subjected to another test. I went for minor surgery to extract tissues from the lump. The exercise is known as biopsy. So the tissues were extracted from the lump, and they were taken for further analysis. After that, I got the results, and the results shocked me because I was not prepared for such a message. I I was not cancelled to receive the news. So after that, I was shocked, and it was like I ran mad, sort of. I was confused. I screamed. Uh, Lucky enough, my family was around. Uh, my daughters-in-law are around, so they hold space for me. They took me back home. I broke the news to the rest of the family, my husband and my sons. It was a sad moment for the whole family. So, thanks to God, I have good friends from church and neighbors. They came through, and I was also introduced to Coast Hospice, where I met a psychologist, a very good psychologist known as Dr. Farhin and Dr. Eric. Both of them hold space for us and took us through counseling, and informed us what it will entail emotionally working through cancer. And through the counseling, we were able to calm down and came to agreement with the diagnosis, and sat down and made a decision as a family on a way forward. Personally, I came to terms with it, and I agreed to face it. So I started the treatment by surgery, and I chose removal of the breast because there are two options to surgery. The first one is breast conservation surgery, and the second one is mastectomy, which is removal of the whole breast. So I opted for the second one, and I went for surgery. But after surgery, it was nasty because seeing myself having lost one part of my body, I didn't want to face the mirror. It is not good. I mourned. I mourned because I saw myself lesser of a woman. So I had to undergo several therapies, and I didn't want to look myself into the mirror for 3 months. I couldn't look myself into the mirror. So after 3 months, I came to terms with the condition. And then I started the second line of treatment, which is chemotherapy. I did chemotherapy for 6 months, a session at an interval of 3 weeks. Chemotherapy has very, very tough side effects. In cancer treatment, the most difficult part is chemotherapy. Chemotherapy is a mixture of toxins which are administered through veins, intravenous, and the toxins, or rather the medicines, are normally you are administered to fight the cancerous cells or kill the cancerous cells. In the process of killing the cells, they also kill the good cells. That is why you have to fight with your immunity, because you see a patient losing hair. I lost six of my teeth it triggered early menopause on me. My bones were weak, very, very weak. I have memory. We normally call it chemo brain. Like I have memory lapses. Sometimes I look like I'm stammering because I struggle to remember words. It has so many challenges. Financially, the burden, the treatment is very, very expensive. So like it is very, very tough. I underwent the sessions for the 6 months. I lost my body fluids like tears. I used artificial tears. My eyesight to date is not good. um I lost many things. Plus, losing the breast for a woman, it's something very important. And my self-esteem went down, like down to zero. I felt unproductive. I felt useless. So after finishing chemotherapy for the 8 months, and then I started the third line of treatment, which is radiotherapy. Radiotherapy, I did 20 sessions of radiotherapy. And the side effects of radiotherapy, I used to nausea, and I just felt tired, like very tired. I couldn't do anything. After radiotherapy, I am 10 years. And the hormonal therapy, because my cancerous cells or my hormonal receptors prove that they need to control the hormones. So I take the drugs which triggered the early menopause, and I have that condition of kukufa ganzi. I don't know ganzi in English. I can't remember the name. A numbness, yeah. I feel numb. Sometimes I can hold the glass and it falls down because of the numbness. I can't feel my fingers. Sometimes I can't feel my feet. But above all, I've fought the battle. I call myself as a champion. I'm still championing, and I'm there to create the awareness that one can survive cancer. We can rise above cancer, because cancer must bow. As warriors of hope, we do advocacy because we've seen their gaps.
Wait. I'll come to you. Thank you very much. I would want to understand what you do at Warriors of Hope. But yeah, I think that story is really touching. And sorry for what you've gone through. And we thank God for the far that you've come. Indeed, you're a champion. Shazmin, to you, you're a caregiver. How do you care for a cancer patient?
Yeah.
How should one care for a cancer patient? Because I believe there are other patients in our houses, and people just don't know how to care of those patients.
One of the ways of caring for cancer patients is by first letting them know, educating them on the process they're going to undergo. Most of the times, just like Mary has mentioned, there is no counseling that is done before the diagnosis. So you get that most of the patients even refuse to undergo treatment because of the things they hear from the society, like someone being in the illusion that chemotherapy is a machine that you have to be kept in, so anakataa kabisa the treatment. Some people have that illusion that radiotherapy unachomwa, so you get that cancer education is really important to cancer patients. They have to understand whatever they're going to undergo, what process they're going to undergo. They also have to understand the side effects that come with it. You can imagine getting into treatment and having those side effects hit you without you even knowing that it's the side effects of the medication. So we prepare them beforehand for the processes by educating them. We also offer psychosocial support to them. There are many psychological effects that affect cancer patients, some of which have been mentioned by Mary. You see the aspect of self-esteem going down to zero, someone losing a part of their body. So the self-esteem is so down, it can even lead to depression, it can lead to suicidal thoughts. We've had cancer patients thinking about suicide and some of them even executing it. So, offering the psychosocial support in terms of counseling is really of help to cancer patients. Just like Mary has indicated in a story, if you followed through very, very carefully, when she joined the hospice team, when she joined it, she was able to get counseling from the psychologist in the team. And through that, she was able to come in terms with how she was going to do the treatment and get over the denial. There's that aspect of denial in most of the time. And apart from talking to the cancer patients directly, we also talk to the family members around the cancer patients. Most of the time, the immediate caregiver and the immediate family member, whether it is the husband, the son, the daughter, the aunt, whoever is living with them, they also have to understand what changes the cancer patient is going to undergo so that they can help the patient get through it. And yeah, actually, I'm not going to use the word patient. I'm going to use the word fighter. There's a lot of fight. There's a lot of battle they are undergoing through, and such such things can really help them. So offering them education, offering them the psychosocial support. We even have cancer patients who are stigmatized by the society, stigmatized by their own family members. And some of them even choose to self-isolate themselves by choice because of the self-esteem going down. So those are just but some of the things that we do as caregivers. Thank you.
Thank you very much, Jasmine, for those insights on how you care for cancer patients. Mary, tell us about Warriors of Hope. What is it that you do, and what made you start the organization?
Well, during my cancer journey and treatment, I saw a lot of gaps that many people go to hospital when it is late, when it is in the later stages, and that treating cancer in its later stages is challenging. It's challenging, and it's just managed. That the myths and misconceptions around cancer is one thing. The cancer management also in our facilities has also gaps because the government has not allocated enough funds for cancer management. For example, the national insurance cover, the NHIF, is not covering fully for diagnosis. It only caters for the treatment. If we are to approach the cancer management holistically, we need to include the screening, the diagnosis part of it in order to approach it holistically. I saw those gaps, and many people died due to lack of knowledge because of
I think
the
I've
myths
lost you.
and misconceptions surrounding cancer. For example, our it can help a man not to get breast cancer. You see, those are misconceptions. Somebody said there was a young girl who had cancer, whom I made friends with because she was in excruciating pain. And then when I asked the spouse, it was a young couple, the husband said in Kiswahili, nijiputamba, which means he had not accepted the situation. They had not come to terms with the diagnosis, and they were in the ward, and I had to remove my mastectomy. Mastectomy ni lile titi la kubandika, in order to prove to him that it is treatable, it is curable. I had to show him my scar. I told him this is cancer and it is treatable. And I had to teach him how cancer manifests. I had to teach him how comes the what made the wife to have that lump, which he called that jipu. And I had to teach him how the cancerous cells spread in the body. So, like by the time I had finished talking to him, he came to terms with the diagnosis. But unfortunately, the cells had the girl had what is called metastatic cancer, meaning the cells have moved from the original location to other parts of the body. So unfortunately, we lost her. But I'm happy that the husband, through the awareness, through my enlightening to him, he was aware that the wife had cancer. We have so many myths and misconceptions, witchcraft, bad omen out there. So this is what we do as warriors of hope. We go out there, we talk to people, we interact, and we make them aware that cancer, anybody can has the cancer has cells. Anybody have them, anybody can have cancer. Like saratani, sehemu ya mwili ambayo huwezi kupatikana nayo ni makucha na nywele, otherwise the rest of the body, haijalishi kwamba ni mtoto, mtu mkubwa, mtu yeyote anaweza kupata saratani. By teaching them, we counter the myths and the misconception, and we also partner with hospitals to do the screening, because our motto is that early detections and interventions and treatment can save a life. We also do advocacy to address the gaps that are there. We do community navigation. We navigate if we have the concerns that we have seen in the community, we help them navigate to medical facilities where they get further investigations. We also navigate through looking for partners who can assist the most needy patients to get NHIF. Sometimes we do fundraise for them. We also offer free prosthetics for the most needy patients, because as a woman, losing a breast is something devastating. So we instill confidence in women by giving them free knitted prosthetics, because by wearing them, it instills back the confidence in them. Personally, I'm wearing them. Nobody can notice that I don't have one breast. We also do charity once in a year. We offer free makeover. We give them wigs and we do makeup for them just to make them feel happy. Like this month we did, and most of them are very happy and they are lively together with their families. We also do mentorship, because we know mentorship is an important aspect in the growth, especially the youth. We do mentorship. Apart from the mentorship, we also have lesson on nutrition, because we know that a change of lifestyle, approaching cancer needs it needs a holistic approach, change of lifestyle, and nutrition is a key to tackling cancer. Yeah.
All right. Thank you very much. I think at the end of the discussion, we'll ask how we'll reach out to you. But first, let's go to Shazmin. There has been some, I don't know if it's a myth or it's a fact, but I've heard people saying if you put your cell phone in a bra, it causes breast cancer. Is it true, Shazmin?
Apparently, prolonged exposure to radiations can cause cancer, but putting of the cell phone in the bra, uh, it's actually one of the myths, because it has to be prolonged exposure. It has to be a prolonged exposure for it to serve as a threat. Radiations, but most of the radiations come from the microwave, from the laptops, and also firewood, by the way. Firewood. Uh, it's okay to use firewood, but prolonged exposure to it. You find those people who stay from morning to night just next to fire burning. there's actually a radiation of the infrared rays. Infrared rays are one of the rays that can actually uh, mutate the DNA of cells, and we know that mutations of the DNA is one of the aspects that can alter cells to form the cancerous cells to form a tumor. So on that, I would just like to say that prolonged exposure to radiation, any radiative object, it can lead to cancer, but not necessarily breast cancer. It can lead to any other type of cancer, like skin cancer. These two should not be confused. Yeah, they should not be confused. Skin cancer and breast cancer should not be confused.
Okay. What about putting on a bra for a very long time? Especially women, when you stay a whole day with a bra, does it raises the risk of breast cancer?
No, no. I hear this a lot. In fact, many people have a myth on that, and they specify it. Kabisa kabisa, they tell you black bra with the wire, or they tell you the wired bras. No, they do not cause breast cancer. You can only get maybe the wires can actually like maybe prick you or hurt your tissue, but they won't cause breast
Okay.
cancer.
Thank you very much for at least opening our ears and eyes on that particular issue. I hear a lot of women with stories. I don't put on bras, so yeah. But thank you very much for
Allow
clarifying
me
that.
to come in on that note
Yeah,
also.
yes, please, ma'am.
Somebody was asking that kunyonywa matiti kunyonywa matiti inasababisha saratani ama inazuia saratani. Let me
Inazuia ama
clarify.
inasababisha?
Wengine wanasema inasababisha, wengine wanasema inazuia. So let me put clarity on that.
So which is which?
Yes, ni kwamba kuna ile inaitwa breast anatomy ama mfumo wa kukua kwa lile ungo, lile ziwa. So inafikia umri fulani katika maisha ya mwanamke kwamba lile ziwa mpaka linyonywe lile zoezi la mtoto kunyonya, ama pengine katika hali ya kujifurahisha, kujamiana, inasaidia katika ule mfumo wa kukua kwa lile ziwa, yani kwa lugha ya kimombo breast anatomy, kwa lugha kunyonya titi. So si kwamba ati kunyonya sababisha saratani, la hasha, lakini inasaidia katika ule mfumo wa kukua na lile ziwa. Pia tunahimiza kwa wale ambao pengine hawajaliwa kupata mtoto, ni vyema kwamba yule mwenzake kama ana mwenzake aweze kumsaidia katika hilo zoezi, kwa sababu pia linaongeza furaha katika familia. Ni muhimu sana katika breast anatomy. Shukran.
Okay. Thank you very much for that. But tell us, there are women, even men, who are actively doing exercise. They exercise regularly. They eat healthy. They don't take alcohol. Do they have to worry about breast cancer, Mary?
We are all pre-exposed to cancer because, as I said, anybody can get cancer. We have so many pre-existing factors like hereditary and drug and substance abuse. Those are risk factors ambazo mtu yoyote anaweza kupata. Because like age, it reaches an age where our bodies produce a lot of estrogen. Estrogen is a chemical that when it's ikiwa nyingi katika mwili, it pre-exposes you to the risk of getting cancer. So like I said, that the cause of cancer has never been established. Research is still ongoing, so anybody is at risk of getting cancer. Thank you.
All right, thank you very much for that question. There's a question from Patricia. Please advise if deodorants that have anti-perspire element causes cancer. And she's also added to what we had already discussed. Is it wearing bras for a prolonged time without changing or washing it? Does it cause cancer? Shazmin, I'll throw that to you. Maybe handle both questions.
So when you talk about the deodorant, it is a myth. It is a myth. Deodorants do not cause cancer, and the wearing of bra for a very long time, especially if you're not washing it, it might lead to other hygienic problems, but not necessarily breast cancer. So yes, on the deodorant, it is a myth. Yeah.
Okay. Yeah, so I think, Patricia, that question has been answered. Uh,
Yes, it has been answered. Thank you very much. I really do appreciate.
thank
Though
you.
I thought the antiperspirant, I don't know where we read from journals or
Can I say
people.
something?
Okay.
Yeah, other risk factors are family history and again risk to certain chemicals.
That is very
Exposure to
true.
Sorry, was it Patricia Munira speaking?
yeah, exposure to chemicals and even family history.
That
These
is
are some
very
of the
true.
causes.
You are right. That is true.
I didn't get the question. And Mary, you're saying it's true. Please try to elaborate.
She was
Then,
adding up that family history is part of the risk factor and the exposure to chemicals, which we had earlier said. That is very true. I concur with her, Munira.
okay. So is breast cancer genetic? Like if one member in the family has breast cancer, there is a high chance of another member getting breast cancer.
Breast cancer can be genetic, yeah, but it is not 100%. It is not 100% affirmation that if someone in your family has cancer, you're going to have cancer. There's a possibility of you even inheriting the cancerous gene and living cancer free if you actually live in a standard lifestyle that will help you reduce the other risk factors. We usually recommend most of the times, actually all the time, we recommend that if you have a family member who has cancer, any type of cancer, whether it is esophagus, whether it is skin cancer, whether it is blood cancer, we recommend that the family members, the immediate family members, check for the genetic code. They have to do a genetic test to see if they have inherited some of the cancerous codes from the DNA of their family member. And if it is the case, they're going to be advised on the lifestyle to live if they have not been affected yet. They're going to be advised on the lifestyle to live. On that aspect also, let's say someone has breast cancer and that gene has been passed hereditary to the family member. It is not necessary, and this person is really, really exposed to the other risk factors and is at risk of getting cancer. It's not necessarily 100% that it's going to be breast cancer. It can manifest itself in another type of cancer. So it can even manifest itself in prostate cancer, cervical cancer, duodenum, any type.
All right. Thank you very much. I think we need to have better understanding of the other types of cancer. But for this month being Breast Cancer Awareness Month, let's focus on only breast cancer. Uh, I love sugar. I take my tea sweet as honey. What are the chances of getting breast cancer if you consume too much sugar? Mary.
As I said earlier,
Mhm.
that we need an overhaul change of lifestyle, including nutrition. Our bodies need the sugar, yes, but everything in moderation. Everything in moderation. Even the oils we use, it's best that we go natural with the indigenous natural foods that we used to eat, because the foods we eat nowadays have a lot of chemicals, and there are so many junk foods, the fast foods. They are not healthy. Like it's best to go the natural ways, the natural herbs, the natural seeds. They are very nutritious and healthy for our bodies.
Right. Thank you very much for that. Yeah, so I'll try to control my sugar.
Please do, please do.
All right. Shazmin, back to you. What are other myths that are very common on breast cancer? Or maybe one or two?
There are many myths actually. One of them being the gender factor that we've talked about. We also have myths in terms of external injury. Someone telling me that I got an external injury, and I'm afraid that it's going to manifest into breast cancer, and they start worrying. So we also have that aspect of external injury. Uh, we have myths concerning witchcraft. Say that hii nimetupiwa, hii ni uchawi tu, hii nimetupiwa ni uchawi. There are many myths, and actually there is another one that was really I don't know how I can describe it. It was really demeaning to the woman. You find someone being told that she's not of good character. Maybe she's had many people touching her, so that's why she got breast cancer. Yeah. Mary, do you remember any other myth that
Yeah.
you come across? I'm trying to
Actually,
remember.
Actually, we mentioned them all: the witchcraft, the bad omen, the, the thoughts that you've been unfaithful, like you've been having many sexual partners, the thoughts that it can only use of family planning, family planning, it brings the breast cancer. There are so many myths around it, so many myths, and the stigma surrounding it. Because when a woman loses the breast, and the way people look at you in the society, like because sometimes you have to walk without the prosthetics, especially when the wound is still fresh, you cannot wear anything. The way people look at you, the way you have lost, when you have lost your hair, the look on their faces is just, it speaks much, it speaks much. People mama, when you pass they start murmuring. It's devastating, it is devastating, and people should know that cancer patients need support from the community, needs just moral support, holding space to them, the patients, and being there for them. Even if you say nothing, but just hold space for that person. Eh, the facial expression means a lot, speaks much. So yeah, there are so many myths and misconceptions, and it is
So
not contagious. It is not contagious. Like people run away from you, thinking that utawaambukiza. Some don't even want to shake hands.
there is a
Yeah.
lot of stigma.
Mm-hmm.
Okay. Right. Well, I'm learning a lot, ladies. Shazmin, I can before I come back to you, I can see you raised your hand. I want you to note that there is a comment here from one of our viewers on YouTube. Is there any truth that if you sleep with the bra on, high chances are you'll get breast cancer?
No, You might get other problems that can come as a result of very less ventilation, maybe that much squeezing, but it won't be breast cancer. As I said earlier, there can be maybe a rupture on the skin or maybe a rupture of the tissue, but not breast cancer. Sleeping without the bra on is really, really recommended for that ventilation and also for the growth of the breast as well. There are many, many benefits to that, but it doesn't mean that if you sleep with it on, you're going to necessarily get breast cancer.
Right. Thank you very much, ladies. I am learning a lot, and yeah, I think this was a good topic. I wish we can go for like a whole day talking about it. Uh, for those who are watching on YouTube, please drop any question you may have. I have Mary Nyaga and Shazmin Kasam. They are all breast cancer educators. Mary is a breast cancer survivor and founder of Warriors of Hope. Maybe we've been talking about myths. What are some of the truths? Let's talk about chemotherapy. High chances of people undergoing chemo, they hardly survive. Why is that, Mary? Or is it still a myth that if you undergo chemo, then there are low chances of you surviving?
Well, that is a myth because I'm here surviving, and
Yes.
it's an I'm well. It's only that you cannot see me because I'm in a bit of mess after losing my friend. I'm not composed
Yeah,
well to show my face,
yeah, sorry.
but I'm doing good. I am well because I did chemo. I finished. I did radio. I finished. There is no shortcut to cancer treatment because the cells have to be killed. And the only medicine that kills the cancerous cells is chemotherapy. The first medicine that attacks the cancerous cells, it is chemotherapy. So there is no shortcut to cancer treatment. Radiotherapy is normally administered later to kill any other cancerous cells that might have been remaining on the location of where the tumor was removed. Otherwise, there's no shortcut to cancer treatment. One has to undergo chemotherapy, and people even die not because of cancer. Some people just get accidents, or your day has just come for you to live. You just live, not necessarily chemo. So that is a myth. That is a myth.
That's very true. We will all leave this world at one point. So if your time reaches, you'll just leave. Yeah. There is a question from Patricia. Which is the best screening method? Shazmin?
Uh, Before I answer that question, I would love to add up on something that Mary said on the
Okay, yes, go ahead.
chemotherapy and radiotherapy treatment. Yes, sometimes it's not even the cancer or the treatment that is going to kill a person. We have to understand that there is also a lifestyle that a patient has to go by when he or she is taking the medications, when he or she is going for the sessions. For example, you have to eat well, you have to hydrate, you have to take fruits. So this is to keep you healthy, to block any other disease that is going to maybe attack you. Uh, Utapata that maybe someone did even die of cancer, as Mary said. I would love to share a short story on that, especially on the radiotherapy. We have many cases of people. undergoing radiotherapy and chemotherapy, but since they have low esteem and maybe less guidance on their side, or maybe they have guidance but they are in a really, really bad state to even go through the process, you'll find most of them refusing maybe to eat, refusing to get hydrated, and it's really important after doing this process from the hospital. When you get home, you just take care of yourself, take water, take fruits. When you're undergoing radiotherapy, you have to take a lot of water and fruits because it's beams of ray actually uh, directed upon you. So it can bring about sores in the throat. And someone might think that it is the radiotherapy doing that, but it's actually the patient not hydrating herself or himself well enough after the process.
Right. Right. Thank you very much. Uh, Patricia, was that question answered? The best method for breast cancer screening?
Yes,
Okay.
thank you so much.
Okay. I know you are not doctors, but Mary, I'll throw this to you. Uh, is all breast cancer treated the same way? You have an idea?
That's a very good question. As I earlier said that breast cancers are different. We have different types and everyone has different hormonal receptors. So like the, the treatment plans depends with your the type of breast cancer you have and your hormonal receptors. It is the doctor to decide that after subjecting the sample retracted from the tissue from the lump or the tissue retracted from the lump, having gotten the histology or the analysis from the laboratories, it guides your team of doctors. Actually, it's a team of doctors, the surgeon, the breast surgeon, your oncologist, your radiologists, and maybe the anesthetic and the whole team. In total, it's a team of doctors. They sit together, they review the results of your histology, and then they come up with a treatment plan which they share with you. They tell you the options, the pros and cons, so you make you together come to a decision on your way forward on your treatment plan. So it is a procedure, like it's a teamwork thing when addressing the issue of treatment plan.
Okay. Thank you very much. Shasmin, I know we've mentioned this on anyone can get cancer, but young people, say children or youth, what are the chances of them getting breast cancer?
So in the previous years, the percentage of the youth getting breast cancer has risen. So yeah, there is a very very there is a chance of the youth getting breast cancer, especially after the breast has fully developed. That is from years after a couple of years after puberty and above. Uh, One of the factors that has been studied and agreed upon to bring this drastic change is the change in lifestyle. The lifestyle that we are adopting nowadays is exposing and youth in cancer. Uh, and we also have the childhood cancer. Yeah, we have children as young as months old, as young as less than 10 years old, getting cancer. So yes, we have a percentage. We have a percentage.
Right. Wow. Okay. Mary, this question is to you.
Yes.
People say if you are a survivor, then you have defeated breast cancer. Are there chances of it recurring?
Yes, sometimes it occurs that one has a recurrence. And like I said, treating cancer is never easy. Like you go through the whole treatment plan, you are declared cancer free, and then some cases people stay like 5 years, 6 years, and then boom, there's a recurrence, and then you start fresh the treatment plan again, another different treatment plan. So yes, chances are there for the reoccurrence, but what is most important is your attitude because, as I said, the cause of cancer has never been established, and it can go and come back. It's upon the patient to have the right attitude and face it, the warriorship, face it, and the supportive system, like the people around the patient, the community, because once one is affected, the whole community is affected. So like it needs a holistic approach. So the patients need support, not stigmatization. Like some people say, imemrudia tena, like wow, how comes? What did not go well? Ama, what happened? He didn't live well. He didn't follow the instructions. Such like things are never important. They don't assist the patient. So wherever there's a reoccurrence, the attitude matters, the approach,
Yeah.
how the patient is receptive, how the people around the patient are receptive towards journeying with the patient. Yeah.
Okay. Okay. Treating cancer is very expensive. Why is that so? And what do you think should be done? Maybe this question will be to both. Shazmin, would you want to start?
Yes, I would like to share one concept that maybe most people do not know about cancer. Cancer is different from any other disease in the way it attacks. The other diseases actually attack the immune system directly. For example, HIV/AIDS. So the mechanism put in place to compact it to actually like suppress those cells is different from cancerous cells in that the cancerous cells do not attack the immune system, they hide away from the immune system, they repel from the immune system. So that is one of the factors that make the treatment really, really expensive because they are going to apply a different mechanism than any other mechanism of any other disease or illness. I think I'm going to throw this to Mary now.
Mary, yeah. Okay.
Yes,
Yeah, Mary, please add on that discussion.
uh, fighting cancer is expensive. You're battling something that you don't know its cause. You don't know where the enemy is coming from. Like you try to be on a lookout on this area, the enemy comes from a different area and attacks you like to the core, hits you to the core. So like the research is still ongoing, and like we say, it's the approach towards treating cancer is still on research. Thanks to God that we have the cyber knife at KU, which was recently launched, but it's only one machine. And if we look at the statistics of the cancer numbers in Kenya, it's wanting. Like we look at our facilities, the radiotherapy center in the whole of Coast Province, we only have one radiotherapy machine. Still, I thank the government for having thought of bringing that one machine, but it's still wanting because during my time, I had to travel from Mombasa to Nairobi. I had to look for a place to stay, and it was during COVID season. I had to look for transport for private transport. So like the cost is too high because we are still fighting something that we have not established its cause. So like utafiti unafanyika kila siku, kila kuchao tunakuja na utafiti huu, lakini bado tunakuta kuna changamoto ziko nyingi. In the advanced countries like nchi zilizobobea kama Marekani, Israeli wamebobea na approach towards the treatment. They have advanced medication. They have a holistic approach. At least you can see the numbers of the mortality numbers have reduced. But in our country, especially African countries, we are still struggling. We are still struggling. And also the government allocation to cancer management still needs to be improved. For us to curb the mortality, we need to approach it from the preventive way. And the preventive way includes the diagnosis, like utaenda ufanyiwe screening uonekane uko na uvimbe. What next? You have to go for the testing. For the tests, there are numerous tests. Can one afford the tests? Watu wako na bima ya kuweza because few people have those private insurance that cater for the diagnosis. Majority of people don't have cash, and the National Hospital Insurance Fund only caters for the treatment to a certain percentage because there are some of the hormonal receptors that need very expensive medicines. So sometimes inafikia kwamba the family has to do a top up because the voted that is given by NHIF, it reaches a time that it exceeds. So like if you send a requisition, if you send a requisition or yeah, and a requisition to NHIF, it's a declined. You find that the patient has to look for more money, has to source for more money in order to continue the treatment. So unapata kwamba ule mfumo wa matibabu unasimama kwa ukosefu wa fedha. So serikali inastahili to go a notch higher in cancer management, like allocation to the cancer treatment, and also on the terms of advocacy. Like we need the voice of the survivor, the voice of the patient. It is very, very important because we have borne the shoe. We know what it entails to undergo the cancer treatment. For instance, we need supportive devices like the prosthetics for women. One prosthetics, I bought a prosthetics at 5,000 shillings. Imagine you've undergone that financial burden of the treatment. Now it's like you are a bit well kidogo, you want to go back to your normal life. Here comes the burden of looking for the supportive devices. I went for swimming with my family. I had worn that the knitted prosthetics, zile za bandia, the cheaper ones. I bought them for 1,000 shillings. While I was swimming, ilitoka. It came out, and my kids were, "Mommy, your breast." I felt ashamed. I felt ashamed because it was swimming. It had come out. You can see that it is shameful. And I had to take it and put it back. So in the advanced countries, they have the good supportive devices that will instill your dignity as a woman. So we need those ifikie mahali kwamba serikali itaweza kusaidia wale waathiriwa na vifaa vya kukidhi ile hadhi yako kama mwanamke au mwanamume. Na pia on economic empowerment because we lose everything. We lose almost everything. I lost my livelihood due to the treatment. We sold our properties because we could no longer go back to the same people for donations, for funds. So we had to use what was at our hands to dispose in order to get money for the treatment. So like the economic empowerment, because after treatment, what next? Where do you start from? So the government should also like allocate funds to assist these people for economic empowerment, or they can look for people, for donors who can come through and help these people. Thanks to Kenyatta National Hospital. It has empowered the services of navigation also, because you find that most people die due to the emotional turmoil. Like people go to hospital, they don't know where to start, they don't know where to, watu wanabaki hapo katikati. Like the doctors and nurses are busy with the treatment, but the emotional aspect of it, wanabaki pale mataani. In corridors you find patients are there wailing in pain. After the treatment, you're told go home. The emotional part of the